I will then, without further ado, welcome our next speakers. We have Stephanie Godleski, I really do hope I pronounce these correctly, and Ammina Kothari, who will be talking to us. We now switch gears back to media and social media during COVID-19 and the use of social media and attitudes towards mental health. So I think a really easy and nice segue from our previous talk. Welcome to you both. I know you've already tested the text, so hopefully without further ado, you can share your screens, unmute yourselves. And just a reminder, I'll give you a 5-minute warning in 20 minutes time via the chat. Lift my hand so that you get a visual aid. But I'm sure that this will be a wonderful talk for our audience. So thank you very much.
Hello, everyone. Thank you for the opportunity to present our research. I'm Ammina Kothari and my colleague Stephanie Godleski. She's from Department of Psychology. I'm from School of Communication. And our project looks at the use of social media by adolescents and young adults for mental health support. And we wanted to examine how they're using, especially during what is changing now during COVID-19. So a little bit of background. There is a lot of research has been established that adolescents and young adults spend a significant amount of time on social media, looking both for connections and also mental health support, especially from their peers. Pew Research Center survey results in 2018 found that 45% of the US teens between ages of 13 and 17 report being online on social media or on near constant basis. They also report finding that social media is a good source for support when they're depressed, anxious, or stressed out. So it's both a place to make connections, but also to find support as well. So keeping that in mind, as we know, COVID-19, and especially in the US now, we're still going through a pretty hard time with the pandemic. A lot of schooling went online, starting March, and we don't know how things are going to be in fall as well. And digital platforms have especially become more important, including social media, for not only facilitating connections and support, but also thinking about ways how these platforms where the young adults are on, how they can be used to provide mental health support, but also to identify ways that they are using it, and if there's a way for parents to mitigate some of the effects, especially the negative effects of social media. So research has shown that the use of social media can have both positive and negative effects on mental health, especially with focus on depression and anxiety. So the goals of our study was to look at different pathways that people who use social media, especially adolescents and young adults, use and how they are connected to their well-being outcomes. So instead of just looking at the amount of use and the effects that they're reporting, what is it that they're using it for, and what other tendency do they have that might lead to different type of outcomes. So the first goal was to examine potential social media influences in regards to frequency and motivation for use. So were they using social media to establish connections, for support, or just entertainment, and what were the attitudes toward mental health, whether it was to share their own personal information or to reach out to the peers who might be sharing information on social media. The second goal was also to explore barriers to help seeking experience by adolescents and emerging adults, given the importance of understanding pathways. So what might be some barriers that would hinder people who might want to seek help, but they would not seek it even if the resources were available. And then we also wanted to look at if there was a gender aspect to adaptive functioning, given past research has demonstrated that men and women tend to demonstrate differences in how they not only use social media, but also how different aspects affect them as well. So some of the studies that guided our work was assessment of time and use of social media has been varied, including integration of social media use in daily life. So people who use social media every day are probably going to be seeking different things versus those who use it for emotional connection. So that's the only way they make connection with people, versus you just log in routinely to check in. There are also more negative effects for girls, according to research. And research has also shown that adolescents are more likely to seek out help online and less likely to seek help online for mental health professionals. So we wanted to see if there was any difference depending on who is more likely not only to be seeking help online, but also to reach out to people who might be disclosing information about some health. So barriers could include stigma regarding mental health and fear, stress, and difficulties with self-disclosure and help seeking. So people who are more likely to be willing to self-disclose are also comfortable with themselves and more likely to be willing to seek help versus the ones who are reluctant to self-disclose. So these are some of the hypotheses that we used for our study. The first one was frequency of social media use would be associated with routine use of social media and emotional connection to social media use. Routine use of social media will be associated with more adaptive functioning, that is higher positive effect, lower negative effect, adaptive use of mental health, whereas greater time spent and the emotional connection to social media use will be associated with lower adaptive functioning. Frequency of social media use would be associated with increased barriers to seeking help. And also barriers to seeking help would be associated with lower adaptive functioning. So I'll have Stephanie go over our methodology.
Thanks, Ammina. So to give you guys an idea of how we went about actually assessing our hypotheses, we were able to collect data through Qualtrics in the mid-March to the end of March, which was right around the time that social distancing and lockdown really took effect in some of the areas in the United States. And we're able to get a split between younger adolescents who are 13 to 17 and older kind of emerging adult, later adolescents from about 18 to 24. And our sample was like fairly diverse, and we're able to get individuals who sort of span different educational levels. So understandably, 13 to 17-year-olds are likely to be in middle school and high school, but we were also able to get some individuals who had graduated from high school and beyond. Oh, yep, perfect. And Ammina is our advancing slides controller for today. So for social media use, we wanted to be able to assess use of social media in a variety of ways, given that past research has kind of varied in terms of how social media is assessed, from amount of time spent to number of platforms. And so we wanted to take a look at a variety of ways that people might use social media. And so one was just time spent per day. And so looking at overall approximately how much time individuals were spending, as well as were our adolescents and emerging adults using social media in order to seek help? So are they posting in order to gain emotional support from others? And then in order to get at kind of that motivation for use, we use the social media use integration scale. And that allowed us to see whether or not is it being used for a more sort of social, sort of routine kind of way. So a more moderated approach of just, I enjoy using social media, versus a emotional connection to it in terms of, I get really upset if I can't check and log in. I really like, it's important to me to be able to maintain relationships on social media. And so that one of them being kind of more of an enmeshed sort of and more dependent kind of approach to using social media versus a more moderated social routine kind of way of using social media. And in order to look at attitudes and barriers for mental health services, we took a look at sort of help-seeking propensity. So how much behavioral control do you feel you have over being able to seek help? Looking at psychological openness. So what are your attitudes about seeking mental health treatment, and then also looking at barriers to seeking treatment or mental health services. So things like stigma, so having subjective norms or other attitudes about help seeking or mental health that make it like you feel like that it would be not in your best interest to be able to seek help, or that it's not something that fits for you. And we also looked at self-disclosure, so how comfortable people felt with disclosing. And so things like for people who like might feel like they shouldn't really ever share information about their mental well-being or kind of internal state with others, particularly those who are professionals. And finally, we also looked at well-being, and we took a sort of broad perspective on it, looking at positive and negative affect. And so things like for positive, feeling excited, enthusiastic, active, versus negative being kind of more nervous, anxious, hostile. And so getting a sense of how well like does social media and different ways of using social media, as well as these barriers, predict well-being, as well as attitudes towards seeking mental health. And those attitudes have been shown in the past to be predictive of actual utilization of services. So move on to so in general, just to give a perspective about what we were interested in, just to kind of pull it together, because I'm a visual person, that we were interested in, we've seen this connection between time spent on social media and adolescent and emerging adult well-being, but we were interested in really trying to parse that out a little bit in terms of what about possibly, or what influences might social media be having. So is it how you're using social media, or that the way in which you're integrating it into your social life? And is that associated with like using social media online as a way of seeking help? And then also understanding what happens with your attitudes and feelings about and barriers to to seeking help, and how might that be also influenced through social media use. And we're really interested in looking at both that online and offline potential seeking of help. So are you the kind of person who might seek out help from people online, or are you potentially more so the kind of person who would also feel like it's appropriate and helpful to seek out help from a professional? So in order to look at this, we use path analysis. And so in order to kind of break it down a bit in terms of what we did, we're going to kind of go through phases of sort of showing what connections we saw in our data. So first, looking at time spent on social media, understandably, it was associated with both like routine and emotional connection use of social media. But interestingly, it was also associated with negative affect. If we look at the social routine use, it was then associated with positive affect, and with so higher positive affect, lower negative affects. Ammina, would you mind advancing one?
Oh, sure.
And as well as greater help seeking propensity. And so that's feeling like I could seek help if I needed it, and it would be helpful to do so. And that we also saw that they were willing to sort of reach out for help on social media. For those who are more enmeshed potentially in their use of social media, we actually saw that they had poorer attitudes about potentially seeking help as well, but they were still willing to seek help online, and that they would reach out to others and post for emotional support. And which sort of makes sense and will be reflected in both of our models. If you're willing to seek out help online, and that was also associated with being willing to seek out help from a professional. Looking at our barriers to potentially help seeking, what sort of switches is interesting and different about this model is that time spent on social media was associated with higher stigma associated with seeking mental health treatment, and then that stigma was then associated, understandably, with poorer attitudes about seeking help. And for those who had difficulty with self-disclosure, they were also less likely to seek help through posting. So that's our one more advance, I think, on that one. as well as they were experiencing higher levels of negative affect as well. And as we saw before, as I mentioned, so for our next line, it was that same association where seeking help online was associated with seeking help or feeling better about seeking help offline. I know that was a lot, so I kind of want to do a quick summary just so that everybody kind of gets the take home of what we found. And so we found that in higher levels of social media use, and our teens were reporting pretty high levels of social media use, as in 5 to 10 at least hours a day, which makes sense potentially if they're at home, right, and they have less to do. So, but that's a full-time job, so it's associated, more social media use was associated with higher levels of negative affect and also higher levels of perceived stigma about mental health. We also saw, similar to past research, that being kind of enmeshed and potentially more dependent on social media use was associated with poorer attitudes about mental health. Whereas routine and sort of more moderated use was associated with more positive outcomes. So less negative affect, higher positive affect, as well as a more sort of willingness or feeling like there was an option to be able to seek help. And we did find the connection between online posting for support as with offline feeling like it would be appropriate to be able to seek help from a professional. And our fourth hypothesis was looking at those gender differences. And we actually really didn't find any sort of consistent gender differences here. I particularly looked at our associations with a lot of our main outcomes, as well as things like stigma. And we didn't necessarily really find anything that really consistently replicated anything in the past research or showed any consistent differences between our gender groups.
All right, thank you, Stephanie. So to summarize our study, we found that, when people are willing to, especially young adults, are willing to seek help online, they're also willing to seek help offline. So there is a connection there. If they have difficulties with offline self-disclosure, those are also going to show up online as well. So there is a connection between real versus virtual experiences in a way. Daily time spent on social media might also increase negative affect through lower self-esteem and life satisfaction. So this is very much consistent with other research. So as we think about COVID-19 going into fall semester, for at least here in the US, and probably the chances of a lot of adolescents and young adults still being online, whether they're in college or in high school, and spending time making those connections on social media, depending on how they're using it, they are probably more likely to have negative effect if they are going to use social media for emotional support. And then routine use can be more protective and positive, but again, greater dependency on social media use for emotional connection may increase risk. So I think, especially for parents and caregivers who are thinking about, how to help their teens and young adults keep those connections as we continue social distancing and working from home, moderation is important, but also knowing what type of activities their children are engaging in social media. And also, social media could be an effective platform for telehealth for adolescents and emerging adults, especially during social distancing. There is some new research coming out where this demographic is actually asking for mental health professionals to meet them where they are on social media instead of having to go on static websites to seek for information. So there is definitely an opportunity to develop more innovative ways of engaging with this group. But it is also important to keep in mind that they tend to prefer to engage with their peers. So the connection will also have to be customized depending on the platforms, which keep changing all the time as well. And also knowing that there is a there's variance in the type of engagement with social media. So some use it for routine, who are looking for different things versus those who seek more emotional connection and support for mental health as well. So to talk a little bit about the study limitations, again, this is something we're just wrapping up now. We did not assess parental monitoring or collect parental responses on social media use by the children. So they might have different concerns or different observations if we had done that. We did also not include questions about how the pandemic might have changed the social media behavior. Our questions were more general, right? So we were testing existing measures. And I think if the study was to be done now, after a few months of consistent lockdown, especially in the US, probably the findings might be different as well. And we also did not assess for social media use by number of active social media accounts. So there might be a difference. Some accounts require more attention versus others, and they're just different types of engagement and things that you find. So for example, Instagram is very visual versus Snapchat, which is very quick and information comes and goes, versus other emerging platforms. So there might be different results depending on different platforms, but there is definitely a connection between social media use and positive and negative effects on adolescents and young adults and their mental health. So we will open it up for questions. Thank you, everyone, for.
Thank you so much, both of you, for that really telling talk. I think just even the headline, which is probably the worst way of starting, but that 5 to 10 hours a day is
more than 10, which kind of so I think it was 20% of our samples said they spent more than 10 hours a day.
That's beyond worrying, especially if we go into a fall semester with distance. I'm going to start by turning to some questions that are coming up on the live chat, because they're coming from David Schieferdecker, one of our our speakers from earlier today. He says, he has 3 points, so just allow me to read. He says, I see you have a theoretical rationale for your model. However, I would really like to see the model turned around. So well-being may be a good predictor for social media usage. And maybe we'll start with that, because I'm an optimist. I'd like to see some positive in people spending over 20 hours on their phone.
Yeah, I think that's always difficult with, obviously our data was collected concurrently, and I think it is definitely quite possible that it could go the other way around, right? And that your well-being could definitely be a predictor of how you're engaging with your environment, whether that's online or offline. So definitely would be really interesting. I think maybe that we could take a look at exploring the flip of the model as well. I think first we were really interested in particularly looking at testing some of what past research has looked at with social media, but as a psychologist, I think that I could definitely see how the reverse effects could be very possible as well.
That, and let's try and find some positive in all of this. Then the second point he makes is, alternatively, you could think about doing a cluster latent class analysis, trying to find ideal types of people. And I think that, an ongoing theme today, indeed from David's talk and from others, was these individual differences you've spoken about, gender effects. Do you have something to say on that? This idea of types of people, the way they're using it as a function of those types, for example?
No, I think that could be a really interesting approach to taking a look at our data, in particular, just that, it was challenging to sort of wrap our heads around a little bit about how to break things out and how to figure it out. And I think maybe potentially doing a data-driven way of being able to take a look at how our groups are sort of falling out in terms of individual differences, in terms of what platform they're using the most, as well as how much time they're spending, perhaps how old they are. I think we could potentially take a slightly different approach from that perspective as well, and to take a look at how that might change our findings a bit.
And then his last question, has to do with covariates, and we've been talking about the complex models that we're all having to use because we didn't know what to collect, so we collected a lot. Clearly, it was all hypothesis driven, but he wanted to know if you included things like demographics as controls or covariates. You obviously mentioned this really nice groups, the two groups you had of the younger adolescents and then the sort of younger adults.
Yeah, we definitely included some covariates that had to do with, so age, right? So we had quite a big age range. And so like that was, we included that as well as some of our other, education and some of the other things that I listed as demographics for things that we included, that I tested sort of on a prelim kind of descriptive way to see if there were any differences. And then just to be safe, included as covariates in the model as well, because obviously those things could potentially make a difference. Ammina, do you have anything else to?
Yeah, I was going to add to the earlier point. We also have some qualitative data as well, which we did not go into here. So I think as we continue with this study, it would be interesting to break down by different types of users based on the qualitative responses. So that's something we are planning to look into. So thank you for that suggestion.
Yeah, it just takes a little bit longer for us to code all of the qualitative data that our participants provided us.
Well, that's sort of a unifying theme from this afternoon's sessions. We've had that Reddit study just before. Obviously, David had these hours and hours of conversation data, and obviously here, what I must imagine is also a tome. So I think a general theme from today is how do we make sure we are looking at both sides of the coin, qualitative and quantitative types of data? How do we bring those two together? And I'd love to discuss about that more if you have ideas of how you're going to go about doing that, because clearly they're two very different two very different ways of putting those together, just side by side or actually linking them. I do also have a quick question for myself, if I may. Which is, at one point you mentioned the word posting, but it wasn't quite clear whether you are differentiating. You said you're not differentiating between platforms, but are you differentiating between sort of active engagement where they put something out there, or is it just general usage, so reading and passively absorbing, as it were?
So we had so the time spent being okay, that they're actually just maybe scrolling. Most of them are saying they're using Instagram, which I feel like is a very easy thing to get sucked into in terms of scrolling and taking a look at content. And then we specifically asked them about more of that active engagement in terms of that they're actively seeking out, posting their own content in order with the hopes of being able to get others to respond to them in order to get emotional support. We also, Ammina, correct me if I'm wrong, we asked them a couple other questions too that we are looking at more qualitatively in terms of whether or not they respond to other people who are seeking out help, and whether or not they feel like it's appropriate to post about those kinds of things on social media as well. And so we're going through and kind of coding a lot of their responses on those about kind of whether or not they sort of had positive or negative views and what kinds of comments they were making.
Fantastic. Well, unless you have anything last that you'd like to say, I just want to thank you once again, both of you, for that excellent division of labor and the huge body of work that you are first of all have presented to us, that continue to work on. We hope that you'll enjoy the rest of your day and that you'll continue